John. Like I mentioned earlier, Concentra developed a tool to assess your current occupational health care program. In your case, it would be industrial health. Before I get started, I'll tell you a little bit about how Concentra came about this tool. We wanted to know what a good occupational health care program looked like. So what we did is we asked employers like yourself that question. And the answers were very inconsistent. So what we did is we did 60 focus groups around the U.S. And again, we really couldn't pinpoint the answer. So we went outside the company and paired up with the experts, ACOM and American Medical Association. It was identified through the research that there are 10 must-haves that every occupational healthcare provider needs to have in place in order to have a good occupational healthcare program. Based on our conversation today, it seems like through industrial health you're getting some of the things, however you're not getting some of them. What I want to discuss now is what you're currently not getting, see if there's any way that we would actually be able to help you. You said that you're not getting any communication. You said that your employees are being sent there, and then when they come back, you just have a simple piece of paper that just has something written on it, and you pretty much have to ask them what's going on. And also that there's not really any outcomes based on the injuries or your workers' comp injuries that you're sending there. And so what the experts said is that there should be a structured and managed communication process, that you should receive structured reports letting you know exactly what's going on. Another thing is clinical informatics, that you should have the outcomes based on your workers' comp injuries. Also that the physicians share data with you about insight and what they're currently doing. Next, you said that a lot of your employees, when they get sent to industrial health, they're actually being taken out of work for an extended period of time, and that when you try to call the doctor, no one answers and you can't really get a hold of them. According to the experts, they say that you should have a provider that has an occupational medicine expertise and philosophy, meaning that they use an early intervention medicine model and understand your patient's conditions within the workplace, like their limitations, what they can and can't do. Also, you should have open access to clinicians. You should have communication. You should have a relationship with them, and you should be able to pick up the phone and give them a call and see what that patient's return to work plan is. Because you're the employer, you have the right to know what's going on with that injury. Now, to address these 10 must-haves that the experts came up with, we've aligned the following 4 keys that we should provide to you in order for you to have a best-in-class workers' compensation program through us. The 4 keys that we've developed: employer engagement, patient engagement, clear communication, and quality medical outcome. Based on the 10 must-haves, you are currently, like I said, you do have 2. However, the 2 that you're not getting is clear communication and quality medical outcomes. We'll start with clear communications. Now, through Concentra, communication is a big key to us. Now, what we do is at the end of every visit, we give an employee that activity status report that I went over with you, that I discussed with you earlier. Now, what we do is we set it up so that we send it directly to you. If you want it via email, fax, or if you want it weekly or biweekly. Now, what that has on it is the employee that came in, their diagnosis, treating physician, and their limitations. Also on it there, it has their next visits. So you know right there when they're coming back, who they're going to be seeing, and what they can and can't do when they go back to work. Another thing is direct access to clinicians. To the physicians, sorry. What happens at the end of every initial visit is the doctor will give you a call, let you know the status of that employee, if they were referred out or any of the outliers, something that, if what they see, and just the game plan, what's going to happen with that employee when they're going to be back. Next is quality medical outcomes. Now, what we do is Concentra follows an early intervention sports medicine model, which speeds up the recovery time and gets your employee back to work. And we have this early intervention is pretty much so that they come in that day and they're treated. Like I was telling you before, we have a facility with multiple things under one roof, physical therapy being one of them. What happens is the doctor walks them straight over to physical therapy. They'll start treatment that day. And there's also communication between that doctor and that physical therapist, so there's no mix-up there. Also, all of our physicians and everyone have, and their physical therapists have occupational medicine training. So they really understand the occupational health care world and how it affects your company and what's going on with that. And we have occupational medicine expertise as well, meaning that there are a national network of occupational medicine physicians within our company. Now, do you have any questions about that? No? Okay. Like I said, what I wanted to do is I wanted to get you out to our facility, just so you can see the way that everything works in our facility, and so you can meet the doctors. You can ask those experts, the doctor, the physical therapist, any questions you may have. And if you have any more questions about this, I would love to go into more detail about everything and explain anything else that you would like. No questions? All right, thank you. Have a great day. I'll see you next Thursday.